This patient was referred to me for examination and evaluation of few teeth. I want to teach you guys how to speak to a patient such as this patient that I had yesterday. She comes in, she complains of sweet sensitivity on the upper right side. Okay. Just sweet sensitivity. No pain to heat, no pain to cold, no pain to biting and chewing on the tooth. I examine all her teeth. Number 3, within normal limits to percussion, palpation, and cold. And you can see the bite wing, and you can see the decay here, right? So very likely tooth number 3 is responsible for her sweet sensitivity. So if you're a general dentist and you see a case like this, patient comes into you, complains of, let's say, just sweet sensitivity, no complaining of pain to heat, cold, biting, chewing, or spontaneous pain that would wake her up in the middle of the night, or pain throughout the day, achiness, none of that stuff. Just some sweet sensitivity, and you find something like this, you can see the decay here. If you're a general dentist, you tell the patient that. You say, okay, based on all my tests today and the radiograph, look at the decay here. This tooth has a cavity. What I will do for you is I will clean out the decay. Hopefully the nerve of the tooth doesn't get exposed as I'm cleaning out the decay. If the nerve of the tooth gets exposed, then you perhaps maybe need a root canal. If the nerve of the tooth doesn't get exposed, I will remove the decay and fill this tooth for you, and let's see how the tooth behaves. If the tooth behaved very well, meaning that you experience no symptoms, no pain, no spontaneous pain, no achiness, no pain to cold that lingers, no pain to heat, no pain to biting, all of that stuff, then that's great. We avoided a root canal. But if after I cleaned out the decay and filled the tooth, you start to have symptoms that would mean that this tooth would need a root canal, then you're going to need a root canal. This is how you talk to the patient. You educate the patient, you inform the patient, you let them know that her tooth may or may not need a root canal. Now, if this cavity was substantially larger, and based on the radiograph, I could tell that I would definitely hit the nerve. Or if the decay was so larger that it had already encroached into the pulp tissue, then I would tell the patient you will need a root canal, regardless of whether you have symptoms or not. Once I am removing the decay, the nerve will definitely get exposed, or the nerve has already gotten exposed if the decay is really, really large. So these are the things that I will tell the patient. I will talk to the patient. So patients need to know these things. You can't just go in and start drilling. Oh, now you need the root canal. You can't do that. They need these situations. These situations need to have been already discussed with the patient before you start drilling on a patient's tooth. But your goal should always be to try to avoid a root canal for the patient. That's the goal. So, as I said, if you have a case like this that's a borderline, you can be very careful. What I would do is I would start with the high speed, lots of water. I don't want to heat up the pulp here, and clean out some of the decay. Then I would start with the slow speed and very carefully, very gently, very carefully remove the remaining of the decay. Again, the goal is not to expose the pulp. And then I would go to a sharp spoon and I would remove the remainder of the decay with a spoon. Again, I wanna avoid a root canal here. All right, now let's say this patient goes back to the general dentist, or you're the general dentist, and you clean out the decay very carefully and you fill this tooth. You fill it. Patient comes back a few days later and tells you that the tooth is sensitive to cold. And you ask the patient, how long does it take for the cold sensitivity to go away? Patient says a few seconds, 2 or 3 seconds. You test the tooth, percussion within normal limits, palpation within normal limits. Cold, yes, it's a little bit more sensitive than the adjacent teeth. You test all the other teeth and then compare the cold sensation of this tooth to the adjacent teeth. And yeah, this tooth is a little bit more sensitive than the other teeth, but there's no lingering pain. The cold sensitivity goes away within a few seconds, 2, 3, 4 seconds. And I'm assuming that you use the rubber dam, okay? You use the rubber dam. You put a rubber dam on before you worked on this tooth. You cleaned out the decay under the rubber dam. And you filled this tooth, restored this tooth with whatever material, usually you guys use composite, using a rubber dam. So there was no contamination of the composite with saliva and what have you, blood, saliva, there was no contamination. And you layered the composite. You didn't do a bulk placement of the composite and the curing of the composite. I'm assuming that you did everything right. And still this patient comes back to you and there's some cold sensitivity. No heat sensitivity, no pain to biting or chewing, just some cold sensitivity that does not linger. Then what do? Then this is what you need to tell the patient. And I tell my patients are referred to me for the same reason every day. I tell them, you have two options with this tooth. One option is, you say, I can live with this. This cold sensitivity is not too bad, and I can live with it. It's not a huge deal. It's not a big deal. Okay, so that's one option. We don't do anything. You can live with it. The other option is, you say, patient says, I can't live with this. Even though the cold sensitivity is not bad, but I cannot live with it. I cannot live with this cold sensitivity despite the fact that the cold sensitivity is not too bad. Then root canal is the only alternative. Root canal is the only option. So this is how you talk to the patient. If you can live with it, live with it. We don't need to do anything. If you can't, root canal.